right, everybody, welcome back. Dr. Blumenthal here in the Bethesda office with Natural Transplants. Again, the new normal with all the masks, so hopefully you can hear me. But we are excited to have Matt here with us. Matt's from nearby in Virginia. Matt, if you wouldn't mind just give us a quick kind of explanation and what brings you to us and what we're looking to do today.
Yeah, sure. I noticed I started having some hair loss, some recession in the front when I was like 16, 17. And I'm almost 29 now, and it's kind of slowed down. Luckily it's not too much hair loss, as you can see, but it's still something that bothers me. It's kind of hard to style my hair sometimes, and it gets messed up. And so I just want to kind of restore the hairline a little bit as best as I can right now.
And I think Matt's a great example, and we talked a little bit about before. Oftentimes we do, men and women, but men especially, with significant hair loss. It's okay to do it even if you don't have significant hair loss. If you look in the mirror and it's just a little bit of a hairline or in the corners and it's something you don't like, we can do that, and that's fine. The thing you have to understand, and we chatted about this, is that the hair we transplant is permanent, but you may continue to lose more hair as time goes on. So you may need or want a second procedure or even a third procedure down the road if and when the hairline marches back even further. But I'm going to have Dr. Lee kind of come in here and see a little bit, because you do hide it well. But once we sort of pull the hair back a little bit, you can see the thinness in the front hairline and the recession back up in the corners. This side is a little worse, especially where the temple is. And we may recreate the temples a little bit and bring the temple, the angle of the temple back, or up, I should say, to fix that. But this is great. I think this is a great example of something we don't typically see in our videos. Typically we see much more of a loss, but this is very reasonable to do, as long as you go in knowing, hey, this may be the first step in a series of steps. If you need it. Now, if you don't lose any more hair, awesome. But you got to be prepared for that. Yeah. Cool. Well, I appreciate you doing this, man. This is awesome. Thank you so much. We'll check in back in later. We'll draw everything out and do a little bit of shaving, and then we'll do a quick another video afterwards to see the game plan. Cool. All right. Thanks, man. Welcome back, everybody. We are back with Matt, and as you can tell, we drew in our line here and did a little bit of shaving, and so brought it down subtly. Brought the hairline down a little bit, but especially kind of worked on the corners here. He did have some, like we said before, asymmetric loss of his temples. But we're going to reinforce both, because what we want to anticipate is the loss of the other side as well too. So we're actually going to bring out the temple a little bit on this side. This was the area that he had more loss in. But we are going to reinforce the edge of this temple, to anticipate further loss. And you can see we brought back, coming all the way back in here into the recession areas. So overall, subtle, but I think it really reinforces the hairline. Nice masculine look. How do you feel?
Great.
Doing good?
Doing great.
Awesome. Yeah. Let's do it. We're excited. We're going to head next door, start up, and we'll catch up with you a little bit later.
Great.
Sound good? Awesome. All right. All right, Matt, we are back. We're sort of the final stages of the graft plants implantation. How you doing, man?
Good, man.
Doing okay?
Yeah, relaxing, watching a movie.
And you actually skipped lunch. You just wanted to power through, so
yeah,
you're just hanging out. May have dozed off a little bit there, but just watching some Netflix and hanging out. How was the pain before?
Like almost no pain.
You were a rock star on that. You did very, very well with it. So. That's awesome. We got Saul and Ron finishing up. Probably be another 5-10 minutes, and then we'll go over all the instructions after. All right? Cool, man.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.